welcome back to Sunday Breakfast right here on ChannelOne TV with me, Inusafo, and Kweku David. So we're going into our health segment. We're talking about Candida infection. And so if you're a lady, even if you're a man, I think you should sit up and pay attention to this conversation because it's very, very, very important. Joining us, Dr. Oum-Kalsoum Zakaria Adam, public health practitioner and maxillofacial surgeon, to have this very important discussion. Doc, how are you doing? You're wearing your black and white like Esquire. How has your week been?
Oh, it's been okay. It's been, yeah, I can't complain.
Yeah, I can't complain.
Hey, I see. That is good.
Yes,
Yeah, that is good.
I can't complain.
Yeah, so we're having a conversation this morning.
Yeah.
We're looking at the Candida infection. Last week we were talking about STIs.
Yeah.
And you did touch briefly on Candida as well. Okay,
Yeah.
so we're going to go into a bit more detail.
Yeah.
All right,
for Candida
so take us into that.
Okay, so Candida basically is it's a fungal infection. Okay, so we are going to focus more on the vulvovaginal Candida infection.
Okay.
Because it's very common. So when you have this Candida albicans, most of the time, so Candida is a kind of fungal infection. And when you have, we have different species, but about 90 to 80% of it is caused by the species Candida albicans. So when you have your vulva or the vagina being infected with the Candida, then you tend to have candidiasis. And most of the time we would say that the vagina or even the skin, let's say the skin, let's start from the skin. So the skin, the oral mucosa inside the mouth, and then inside the gut, where when you eat, it goes through. It has something we call flora, normal flora. And the flora is made up of some bacteria, and then you have some fungus as well there. And they live in harmony, okay, to help with our daily routine and then activities. But then the moment when you look at the mucosal tissues in the vagina, and you notice that there's an overgrowth of the Candida albicans, such that it has replicated and caused an infection, then you say that you have Candida infection. And we say Candida infection is actually very common. When you take, for instance, in women, about 75% of women, once in their lifetime, may end up with Candida infection.
I see.
And the recurrence rate, sometimes we see about 10%, it's been quoted, 10% to about 50% may end up having a recurrent infection.
Oh, wow.
So why do people end up with Candida infection? It has to do with certain risk factors that we have. So if we look at, most of the time now, people just go and then they indulge in taking some antibiotics for prolonged periods. So when you take antibiotics for prolonged periods, it means that the balance is affected. So the good bacteria that tends to suppress the overgrowth of the yeast or the Candida, you notice that you kill that bacteria. So if you kill that bacteria, it means that now the fungus is at liberty to replicate and then overgrow, and then you end up with the infection. Another could be hormonal changes. So if you have some hormonal imbalances or surges, you have more estrogen at certain points in time, you tend to have reduced immunity, and that can also predispose you to coming down with Candida infection. Again, we say that most Candida infections are mild, but then in certain situations, you tend to have very severe forms. And those severe forms typically are seen in patients who do have immune compromised states.
Okay.
So when we say immune compromised states, like patients who do have, let's say, HIV, which is not controlled, people who have diabetes that is also not controlled, people who have malignancies and what have you. So in such cuts, in these brackets of people, you also tend to have very severe forms of the Candida infection. And then, so we've spoken about hormones, we've spoken about antibiotic use, we've spoken about high sugar levels or uncontrolled diabetes. So these are some of the risk factors that can predispose you to coming down with the Candida infection. Now, how would I be able to tell that I do have Candida infection? So most of the time, you notice that people will say that I have this itchiness, the urge to itch, and it's very itchy. And most of the time, it's either when it's cold or warm, in let's say in the evenings, that it becomes severe.
Yeah.
Okay, so you tend to itch the area, and then it becomes such that it becomes sore or reddened when you look at it or you visualize it, and it becomes swollen. So you notice that the vulva is swollen, and then the vaginal area
From
is
the
off
scratching.
From the scratching. And then you have a discharge as well. So this cheesy discharge, okay, most of the time it's odorless, or it may have a little bit of odor, but not typical of other diseases that may have some discharge. Okay, and then aside the redness, the pain, now when you are urinating, you may have some burning sensation as well.
Due to the scratching.
Yes, due to the scratching and due to the little sores that you may have actually caused from the scratching due to the discomforts that you are experiencing. Now, Candida doesn't only affect, as I mentioned, the fungus is on the skin. You can find it in the mouth, you can find it in the gut, you can find it in the genital area as well. Now, when you have Candida also in the oral cavity, you tend to have this reddened or sometimes a white patches all over in the mouth. And these white patches are easily scrapable. So when you try to scrape it, you notice that it leaves a raw area, a raw sore area. Then it's likely that you do have. And it's typical in, when I said the severe cases, it's typical in patients who are immunocompromised. So we call it oral thrush, okay, where you have inside the mouth, there's a lot of white patches, and then the moment you scrape it, it leaves a raw area which can easily even bleed. And it's very worrying, because most of the ladies would say that, oh, I had this infection, I was scratching all over, and I felt very uncomfortable. Even it affected even work, because in certain times, even at work, I tend to become very uncomfortable and I can't even concentrate and then do the work that I'm supposed to do. So raising awareness about Candida infection is very true. And also, I would want to take this opportunity to quickly look at some of the myths surrounding it, because people will say that, Candida or white, we commonly call it white.
Yeah.
When you go and then use toilets, you know, you pick it up. But really, it is not. You sitting on a toilet should not, because the Candida needs certain conditions to thrive. And as I mentioned, it's an imbalance, because the good bacteria, for instance, the lactobacillus, which is a good bacteria that keeps it in check, is on the low side.
Yeah.
So if it is on the low side, it means that now the Candida or the yeast can overgrow and then give you the infection. And aside you having that condition to help it grow, you need moisture. So most of the time, I don't think when we go using the toilet, even the toilet seats are wet. We don't tend to have that. Every lady would make sure that it is dry. Every lady will make sure that it is well disinfected. And even if you do have the Candida lying out there, it doesn't survive when it is what? Dry, when there are dry conditions. You get it? So that is one of the main myths that I would want to correct. Another is that people will say that, oh, it's a sexually transmitted. It is not a sexually transmitted infection. But then when you do have the infection, it can be transferred from one partner to the other. But for it to grow and flourish depends on the immunity of that individual.
Okay.
You get it? And then certain times people will say that when you use maybe scented soaps and then you douche, that is what would prevent it. But rather, these scented chemicals that you use would reduce the good bacteria that keeps it under control, and rather would end up causing you to get more of the infection than it should be. So these are some of the misconceptions out there that needs to be corrected so that we do understand as much as possible how to manage Candida anytime we are faced with that challenge. So what do we do? Most of the time when you do have some of these symptoms, you need to, especially in the severe forms, you need to be examined. A little bit of the discharge would be examined under the microscope to show that it's really a fungal infection and not any other STI. Remember we discussed STI last week.
Yeah.
We mentioned that some of the STIs come with discharge.
Yeah.
Example, gonorrhea will come with some discharge, but that discharge is greenish or yellowish. So at least you can distinguish it from Candida.
Yeah.
Another would be whitish discharge. So if you do have whitish discharge in bacteria vaginosus, it's also there with some fishy smell. So there are different ways to differentiate other STIs from the discharge that comes from Candida infection. Okay, so you need to be examined from your history, you be examined, and then you follow up with your investigation. With your investigation, you are going to look at it under the microscope to be sure that it's really a fungal infection. Yeah. Once you confirm that it's a fungal infection, then you would want to do some sensitivity to check for the type of antifungal that would be sensitive to it. Remember, it's a fungal infection. So if you do give antibiotics, rather you are not dealing with the infection, but you're rather killing the good bacteria that would rather put it in check. So you'll be put on certain antifungal agents. And these antifungal agents can either come in orals or you may have to use them as pessaries. So pessaries it has to go through some tablets that need to go through the vagina. Okay. So depending on the preference of the patients and certain conditions of the patients, you would be able to be given the right type of treatment, whether you be taking it orally or topically. You'll be using it topically or you'd have to pass pessaries. So those are some of the ways to be able to
get both oral and...
So that will be an overkill. Because if you do, that will be an overkill. If you are using, so maybe the tablets, you can use certain, not only the antifungal, but certain ingredients within the topical agents that will soothe the area. Okay. So you can use that as an adjunct to maybe the oral that you are taking. But if it's an antifungal, I think just one antifungal, either oral or through that route, should suffice to help with deal with the infection. Yes.
Quickly, you're going to ask something?
No, I was just, wondering that you mentioned about the prevalence of Candida within the society and how frequently women tend to get it. Do you ever have cases where a man has gotten a Candida infection?
Yes.
Really?
Yes.
Oh no.
How does it present in men?
No. Now I want to know this.
And then why you answer that? Is it possible to keep getting it from your partner?
Yes, it's also possible.
Unchecked.
Yes,
okay.
It's also possible. So if your partner is immunocompromised and he has, so for the men, you can end up having it on the glands of the penis. Oh. So you see that there will be a white patch there with some erythematous raw area, so which is easily scrapable. And people who have the false skin, who are not circumcised, you see those areas could be also where area of exactly that it can end up growing. So you can actually, and men can actually, but even though it's not as frequent as in women, but yes, men do end up getting fungal infections as well, Candida infections.
Does it present itself differently in teenagers and in women?
Women. Yeah. No, not necessarily. It's the same fungal infection. So it depends on, so I mean, being a woman, being a teenager, yes, and being a teenager, due to you are now growing, okay, so you have hormonal surges. Sometimes your body, you are now growing in sexually, you are now maturing sexually. So certain times you have high estrogen levels, and then this can actually, what's the name, promote the growth of the fungus, and then you may end up having more frequent infection compared to maybe a lady who is actually much more mature than you are.
I asked this because I remember
in secondary schools.
Yes, secondary schools, and you would be shamed for it. Like when we go to the hospital, they'll be like, "Hey, when they mama kwadana."
You see why we had
to. That's a very unfortunate. That's a very unfortunate.
And so most of the girls wouldn't want to go, and they'll hide it. But they are scratching because it's itchy. But it's just our hormones. Because whatever.
So let me ask, as a public health practitioner, what's the general thinking in terms of bringing the information down to the secondary school level where we demystify it and make it, you know, it's something that everybody should understand.
Exactly. So I've noticed that anything that has to do with reproductive sex, your reproductive organ, because of our cultural setting,
it's a taboo.
It's like a taboo. You can't talk about it. For instance, I'll give an example. I do a lot of school activations with the Medical Women Association of Ghana. Certain times when you go to the schools and you want to talk about, let's say, menstrual hygiene, and you want to talk about the vagina. Yeah. So you ask questions, but when it comes to, they are very articulate. But when it comes to, they even just pronouncing the word vagina. You see that they are swallowing their words. Yeah. You get it. Exactly.
You have it.
Meanwhile, that is what needs to be. You know? So possibly getting other stakeholders involved, getting the headmistresses involved, getting our community leaders involved, getting our religious leaders involved may help demystify and then get people to speak up anytime they have any of these infections going on so that they can get the needed help as soon as possible. Because really it is something that is worrying. A lot of people would call you and say that I have been scratching the whole time, and you know, the more you scratch, the more injuries you cause to the area, the vulva, the vagina, and then you have some physical trauma to the area. And that is not, it may end up healing by scarring and all, and that is not too healthy for you. The other thing we can talk about will be the preventive measures. What do we do? The hygiene. Our hygiene needs to be kept top notch. So what do I mean when I say that? It means that you need to change your panties as frequently as possible. The moment you feel that it's wet, you need to have it changed, and you need to wash your underwears very well, and then clean them. Dry them under the sun, so that they are dry at the time that you are wearing them. And make sure that you don't use scented soaps. All you need is plain water, copious amounts of plain water. That's all, to wash the area copiously. That is all that you need. And you don't need any scented, you don't need any detergent to wash. No, you don't need any of those. That will rather kill the good bacteria that keeps the Candida in check. So please make sure that you don't use any. In fact, some people even say they want to put their finger
up there and wash.
What are you washing?
It's crazy. I had a friend in university who would put salt in warm water. Wow. I'm like, what are you doing? It's like, you know, at least once a month after her period,
she
put salt in water and washes her vagina. I was stunned.
Wow.
How do you feel after doing all of that?
All you need is plain water. Plain water. A lot of it. Sometimes if you are itchy enough, you can make the water a little warm. Okay, so the warm water will soothe the area. And that's all you need. Take your medications, allow and make sure that you are performing good hygiene. And if you are cleaning, make sure you clean from the front to the back and not from the back to the front, so that you don't introduce any bacteria to the front area.
And thoughts on panty liners?
Okay, so panty liners, yes and no.
Okay.
Yes, in the sense that one of the things, as I mentioned earlier, is you need breathable underwears. Okay, so the breathable underwears, you should be able to circulate air, okay, in and out, so that the place is dry. But certain panty liners that you use, yes, they collect whatever vaginal secretions that are there, and if you don't change them very frequently, it will now become good grounds for the multiplication of the fungus. You get it? So if you are using panty liners, then it means that you need to be able to detect as soon as possible if it becomes wet to be able to change. Otherwise, just your cotton underwears that is very breathable should be fine so that air can circulate. So don't wear tight underwears as well, because if you do wear tight underwears, yes, that would cause some friction and together with the secretions that you do have there, and then it will create a very damp area, and you have these Candida multiplying or replicating, and eventually you may end up with the infection.
Are recurring Candida infections a sign of maybe a bigger health issue?
Yes, it's possible. It's possible that you are immunocompromised, but you don't know.
Okay.
So if you're immunocompromised, I mentioned all the categories of immunocompromised. So you need to do further testing to be able to rule out any of these. And another thing is uncontrolled diabetes, because it tends to feed the yeast and then cause it to replicate.
Because of the sugar?
Exactly, the sugar. So the sugar within is the simplest form of food that they feed on.
I'm sure Anna is excited about this conversation because she's been saying sugar is a no.
So if you do have a lot of these simple sugars within your blood, and then by extension it gets into your secretions, yes, it becomes very very easy forms of sugar that the Candida can utilize, and then eventually it ends up replicating as much as possible and causing the infection. So you need to keep your sugars down, know your numbers, make sure that you are also indulging in good hygiene practices as much as possible, as we have mentioned them, and breathable, very breathable, nothing tight, nothing to cause discomfort, nothing to cause you to have a lot of secretions in a very confined area for a very long period, and that would help with the replication.
Talking about breathable underwear,
yeah.
In the evenings, do you advise women wear underwear to sleep? And men, this question is not for you.
It's always for us.
It's not for you.
It's for us. I've taken it.
It's not for you because you want the place to breathe and all of that.
Exactly.
Do you advise us wearing?
So it's actually a matter of choice. People are comfortable. I mean, you can wear something that is very breathable, very loose, okay, just for the night. Certain people do not want to wear anything at all. So it all depends on you. So I would say it's a matter of choice. But if just like wearing your bra the whole time, the whole day, you maybe 8 hours within the day you are wearing a bra, okay, and then sometimes
the
they are
amazing
tight.
feeling is taking off your bra,
and
then
yes, and then you feel that it's what a relief. Really, exactly. So same thing. If you don't feel comfortable wearing anything breathable at night, it's your choice. You can actually have a break at that time of the day.
Wow.
That question was not for you.
Yes, not for the
but
men.
I've taken it. Plus the answer.
That question was certainly not for you, but yeah.
So it's very important.
I've learned a lot, and especially for our young girls out there, that it's normal.
It's normal. Please do.
It's completely normal to have it.
Yeah. As many as 75 people would have an infection in their lifetime.
I mean, growing up.
Why are the nurses doing that to young girls? It's not once, it's not twice. I used to go. I remember, even me, I've experienced it. My mother's best friend is a nurse. And when I went to the hospital, she wasn't there. So it was the other nurses who obviously know me. Hey, dear now, I was horrified.
It's like...
I was like, I'm never coming here if my auntie's
it prevents
not
people from speaking up.
Yeah,
it prevents people from speaking up, and that is not good enough. Sad. That's not good enough. We need to let more people know about it. It's normal. Speak up if you do have, you're experiencing any of these signs, and there's help. There's definitely help. You can have the help that you need so that you don't end up keeping the infection for a very long time, and then it ends up causing more physical trauma to you, causing scarring and all of that. Some people scratch to even, bleeding.
Oh, yeah.
Yes. Some
It's
people
itchy.
Scratch, yes, because it's very itchy.
It's itchy.
Yeah.
I've seen people using fans there all the time. Because they're uncomfortable.
Yeah, it is uncomfortable.
Wow.
It's very uncomfortable.
Yeah,
very uncomfortable.
So you're better off without it. I mean, no matter what, if you can avoid.
Yeah.
And then make sure that, and then make sure that you are warm water. Just wash. Warm water should help with the itchiness.
Drink water.
Exactly.
Right?
Drink a lot of water.
Make
sure, and then balance
balance
balanced diet. So that you don't end up having a lot of the simple sugars. In your blood that can
Drinking
also feed
calories.
into the whole. Yes.
Yeah. Dr. Adam, thank you so much.
Thank you so
I've
much.
learned a lot. Kweku has also learned a lot that men can get it.
Yes.
That one surprised me.
Candida infection.
Yeah, that one surprised me actually.
Yeah. Even in the oral cavity. Yeah.
Also, you can have Candida in the mouth.
Yes.
Because you've been doing things with your mouth.
So another.
Oh Lord.
So yes, you can actually end up with Candida infection in the mouth. And mostly for the Candida infections in the mouth, if you go deeper into it, such people are immunocompromised. Yes, such people are immunocompromised.
Because your immune system should naturally kick in and deal with that.
Exactly.
Okay.
So such people, most of the time, they are immunocompromised or they have another co-infection. So either it's another STI that is reducing your immunity and then causing the fungal infection to override the other measures that would help keep it in control. So, yes.
Dr. Adam, we've learned a lot. Thank you so much.
Thank you for having me.
Candida infection. All right, let's go to the